There are advantages and disadvantages to both kidney transplants and dialysis. For the exam, you would be expected to be able to weigh the pros and cons against each other. This would likely come up in the exam with the command word evaluate. This is an instruction to list pros and cons. While watching this clip, you should make your mind up about which option might be the better overall solution for most people. So, what advantages and disadvantages are there to consider? Kidney dialysis requires long and frequent sessions. A typical treatment plan might involve 4 hours of treatment 3 times a week. Patients need to regularly visit a dialysis centre or get a machine at home. This can mean limited freedom, and any trips away from home need to be planned around dialysis centres. What other restrictions are there for patients on dialysis? Dialysis usually requires a restricted diet. This means that anybody undergoing dialysis treatment has to avoid food with high protein and salt. This is to avoid producing toxic waste which cannot be filtered out of the bloodstream until the next dialysis session. Dialysis patients also have to restrict the amount of fluid they drink. This is to avoid swelling and discomfort caused by too much water in the blood. What other disadvantages are there for the patient? Dialysis requires taking anti-clotting drugs. These prevent the blood from clotting during filtration. Clotting means the clumping of blood. A possible side effect of taking anti-clotting medication could be excessive bleeding from cuts and wounds. So what's the relative cost of dialysis versus transplant surgery? Dialysis is also more expensive than a kidney transplant. This is because repeated sessions over time stack up in cost. This means that dialysis tends to be more expensive overall, whether that's paid for by the NHS or by the person if they receive private healthcare. Although a kidney transplant operation is expensive, it's a permanent solution, so is cheaper in the long run. So are there any side effects of dialysis treatment? Dialysis can cause low blood pressure, which can lead to various symptoms. Low blood pressure can cause dizziness, fatigue, and also nausea, but this only happens in extreme cases. How does dialysis compare to transplant surgery? A kidney transplant is a major surgery. There are always going to be general risks of surgery. This is because all surgeries have risks of complications. It may not be worth the risk for patients who may not be able to withstand these complications. There are long waiting lists to get a kidney transplant. In fact, a typical wait for a deceased donor kidney transplant is several years. In the meantime, the patient would continue with dialysis. What other risks are associated with transplant surgery? There is a risk that a transplanted kidney will be rejected by the immune system. So there's a chance that the donor's kidney will be rejected by the recipient. Therefore, immunosuppressant drugs are required. These are drugs that stop the immune system from working properly. However, these drugs cause a higher risk of not being able to fight off infections. So overall, which option do you think is better for most people? In spite of these disadvantages, kidney transplants tend to be the better option for most people. This is because it's a permanent solution and works out cheaper over the lifetime of the patient.
Thanks for watching. If you want to take your GCSE revision to the next level, head over to launchpadlearning.com and check out our smart learning platform that's been designed to get you top results in your exams. We cover your whole specification and make revision fun with interactive quizzes, easy to follow videos and more. You'll be kept motivated by your own AI tutor who's here to support you every step of the way. To check it out for yourself, click here. Or click here to keep watching a selection of the videos from our full GCSE Biology course. See you there!